All right, so we made our model. We picked the best model in terms of receiver operator curve. But we need to think about if receiver operator curve or area under the receiver operator curve is the most best way to evaluate our model. When you look at many machine learning model papers, they do use receiver operator curve, and it's not the wrong thing to do, but you have to bring it back to your own study and check and make sure that ROC is indeed the best way to evaluate your model. Um, ROC is sensitivity versus 1 minus specificity. It's here on the bottom right-hand corner, this graph. And the x-axis is 1 minus specificity, which is false positive rate. And the y-axis is sensitivity, which is the true positive rate. And the higher the curve to the upper left corner, it will give you a bigger curve or like a bigger area under the curve. And the maximum number is 1. So as the model gets better, it should approach 1. And then there's a 2 by 2 table just in case you want to review it later. Um, and receiver operator curve generally uh, assumes that your cohort has positive and negative approximately equal ratio of that. So, uh, but in our study, majority of our patient survived, so it's not really equally distributed. Yes, 25% of the patient passed away, but 75% survived. So it's not, we can't really say that it's equal distribution of positive and negative, dead or alive. Um, so in that case, if we have much larger number of negative cases, specificity, the false positive rate, will tend to be always good. And let me describe this through this example in the next slide. So let's say that we have a rare disease that we want to detect, and we want to find 100 cases, patients with rare diseases, out of a population of 1 million. And let's compare two algorithms. Model 1 uh, retrieves 100 cases, and 90 cases were relevant. So true positive is 90, true negative is 999,890, false positive is 10, false negative is 10. And Model 2 now retrieves 2,000 cases, but only 90 was actually relevant. So now true positive is still the same, true negative is 997,990 cases, and false positive is 1,910, false negative is 10. So obviously, Model 1 did much better because it retrieved only 100 cases and still 90 was relevant versus Model 2, it retrieved 2,000 cases, but the same performance as Model 1 in terms of only 90 relevant cases. However, since the number of negative cases dwarfs the number of positives, the difference in FRP is mostly lost. This number is so big for the negative cases. So when you try to plot this on ROC, sensitivity when you do the calculation, it's 0.9. False positive rate when you calculate it, it's 0.00001. For Model 2, sensitivity is still 0.9, and false positive rate is 0.0019, which is not that big of a difference between the two. So when you plot it, you don't quite see the difference of which did better in terms of Model 1 versus Model 2. So what should we do? So there's another way to measure your model, measure the performance of your model, and that is called precision recall curve. Precision recall curve does not consider the true negative. So even if there's a lot more true negative, it doesn't consider that into the calculation, and I'll show you the calculation right now. It will not be affected by the relevant imbalance of positive and negative as well. So in precision recall, instead of considering false positive rate, it considers the precision, the positive predictive value. And let's do the same example as the previous and recalculate the precision. The precision is true positive over true positive plus false positive. So that will be, when you do that calculation, it's 0.9. Sensitivity is still 0.9. And model 2, now precision is 0.045 and sensitivity is 0.9. So now you could see a clear difference in precision between model 1 and model 2. And that is quite big. And then you could see that clearly in the graph. So now you could tell clearly that model 1 is much better than model 2. And yes, these are just single points in ROC or PRC space or the curve. However, if these differences persist across various scoring threshold, you'd see a very small difference between the two algorithms in area under the ROC, whereas area under the precision recall curve, you would see a quite large difference. And let's just compare it side by side. And recall, the sensitivity, is the same metric for both ROC and precision recall. However, in imbalanced data set, even a model with poor ability to detect positive can achieve a high area under the receiver operator curve. That is because false positive rate, 1 minus specificity, can remain low by correctly identifying the abundant negatives that it has. The precision recall is more sensitive to these kind of issues because it focuses on the true positive rate, the precision, the ability of the model to identify the rare positive cases. So in summary, if prevalence is low, or if there's a big imbalance between positive cases and negative cases, we should consider using area under the precision recall curve instead of receiver operator curve. So now we reran our AutoML, and then now we see that stacked ensemble model is still at the top, but you also see a little bit of a decrease in value between ROC and area under the precision recall curve. And here is our precision recall curve for the stacked ensemble model. So now that we found the best model, the stacked ensemble model, in terms of area under the precision recall curve, which is shown here, we need to find a threshold. And you might think like, what do you mean we already found the model? Yes, we found the model, but now we need to find a threshold because let's say the threshold is over here. Like we say the model decides to take the threshold over here. Then you have a really good precision, but the recall is pretty bad. And if you're over here on the threshold, if you give a threshold for that model down here, your recall is really good, but your precision is sacrificed, right? So somewhere around here is optimal balance between precision and recall. Once we find that threshold, we could make a binary classifier. So if we have a patient, the model will be able to say that this person is more likely to die or this person is more likely to survive. So here's a red dot over here, and this red dot will move along the entire curve and find the optimal place that has a right balance for recall and precision. So now our question is, how do we find that right balance? Well, often in machine learning studies, we use something called the F1 score. The threshold that maximizes the F1 score is the optimal threshold. And I'll show you the equation for F1 score. So F1 score is calculated like this, and it is the harmonic mean of precision and recall. Basically, you have this equation, and then let's say you pick a point here, and you get the recall, and you get the precision for this point, and you plug it into the equation, and you get the F1 score. And then you do that throughout the entire plot. And then you find the best place the best point on the plot that maximizes the F1 score, and F1 score is between 0 and 1. But now the question is, you have to always ask yourself, is this again the right way for us to do this? First of all, what is 1 in F1 score? Is there such thing as F2 score or F3 score? Well, there is. It's actually called the F beta score. Um, F beta score with the beta as a weight. Beta is chosen such that the recall is considered beta times as important as precision. So let's think about our study. Are we valuing valuing precision or recall more? In our study, we value more of the recall because we do not want to miss patients who might die. We want to make sure we do not miss those people. We can tolerate false positives. Let's say the machine says that this person is going to die, but doesn't end up dying. Then that's fine, we could tolerate that. But if the machine says that this person will not die, this person will survive, and yet if it ends up dying, that's we cannot tolerate that. So we want to make sure it's more sensitive and we could sacrifice precision a little bit more. So we chose a threshold for our model that optimizes F beta when beta is equal to 2. So we plug in 2 here for beta. 2, I can't write it with this mouse. There. And then going back to that plot, we plug in all the precision and recall for uh, F beta, F2, and then find where F2 is closest to where it's maximum, closest to 1. And this is the output. F2 maximum we were able to achieve was 0.793. Probability threshold was 0.110. Sensitivity was 0.9. Specificity 0.73. Positive predictive value was 0.5 and negative predictive value was 0.9. And this is the 2x2 table based on that. And that's approximately here on the red dot. So that's pretty much what I wanted to say in the first part of this paper. The critical evaluation of machine learning model performance is important. Our ROC is not always the best metric. Consider precision recall if prevalence of the disease is low or if there's an unequal balance between positive and negative. And choose beta from F beta score based on if you value precision or recall in your study. Don't just use F1 score just because everybody is using it. So that was the second part of this video on critical evaluation of machine learning model performance. I hope that was helpful, and I think that was the very most important message that I wanted to send in this presentation. And you could review the paper if you are if you want to know more about what we did. In the next video, I'll talk about the second part of the paper, what we did, which is trying to understand the black box model of the machine learning models and dimensionality reduction. Thank you for listening, and I'll see you in the next video.